The fortune is in the follow-up. Follow-up can be the best thing you do in your practice, and lack of follow-up can be the reason that our schedule looks empty. Turn patients into advocates by preparing and having better systems for follow-up. Have you ever told the patient that I'll call you back and you forgot? How about those estimates that needed follow-up and you told them you're going to be on top of it, you're going to call them, and you forgot? How about that referral? That patient was in pain and you needed to send a referral for a specialist and you forgot? And you forgot to call that patient and tell them what's next? Things happen. Yes, it does happen. It is very busy in a dental practice, and I understand. So much to get done. But follow-up is an intentional system that we have to place in our practice. We can't just let follow-up be based on memory. Here's the challenge. Susie says to me, I got it all up here. Yeah, but that's a problem because I can't remember what I ate yesterday. For real. And that's the challenge. If follow-up is dependent on memory, then it's going to fail. And if its follow-up is dependent on one team member, it's going to fail. Follow-up is a team system that we have to put in place, and everyone should be aware of how we're doing the follow-ups and where it's located. So let's think about it. If I'm going to promise Max a follow-up, then I need to put it in the schedule. I need to make sure that it's marked and put in a spot. If you don't have a system that helps you with follow-up or to-do lists, please ask. We have plenty of solutions in the market today. Max Assist is one of them. There's scheduled follow-ups, and we love using that because it's easy. You can see it, it prompts you, it reminds you. Again, ensure that there are notes in those follow-ups. Sometimes we see follow-ups that says, call John, but you don't even know why you're calling John that day. Document it, be detailed. There isn't enough details sometimes to help us do proper follow-ups so patients can feel taken care of. Now, follow-ups, they come in different shapes and sizes. What I mean by that is there's different reasons why we put follow-ups in the system, but they are the heartbeat of patient care and practice growth. Keeping our word and saying, I'll call you back, and you actually call them back, it means that you respect your patients and you're not too busy for them. A lot of the times I hear it from patients, yeah, they're too busy, they forgot. That's not a good feeling. We need our patients to feel like we are focused on their care and we care about them. We're never too busy for them. That's why I don't like it when an administrative assistant says, sorry, we're fully booked. Well, it's good for you that you're fully booked, but patients shouldn't feel like it's hard to get in to see their clinician, their dentist, their hygienist, because they put you as a priority. You are their dental care provider, and they want to be seen by you. So we have different types of follow-up. The first one is post-op or post-treatment follow-up. Post-treatment follow-up is very important. Some clinics decide that everyone that got a freezing gets a follow-up. The next day, we block some time in the dental assistant's schedule, the assistant that saw that patient, or in downtime, we do those follow-ups. We do a quick call or a text message asking, how are you feeling? If a patient had extractions or had difficult procedures or even deep cleaning where you feel like, you know what, the patient was uncomfortable that day, the hygienist calls and checks on that patient, just simply saying, how are you doing today? We care. We're checking on you. Now, if you're doing a post-treatment follow-up and you didn't let the patient know before they left that you're going to do it, the assumption is, what, something went wrong and you forgot to tell me? That's why I encourage you to tell the patient and let them know, John, we did wisdom teeth extractions today. I know it's a lot. Go rest, and we're going to give you a call tomorrow to see how you're doing. And call them. What about pending treatment follow-up? Contacting patients who have unscheduled treatment plans to help them move forward with their care. That's very important. The challenge with pending treatment follow-up that I see dental practices not assigning that to anybody. It's everyone's job, which ends up to be no one's job. The truth of the matter, if you don't assign pending treatment follow-up to someone, it will never get done. It's a lot of work sometimes, but it's very important because here's where patients feel cared for and they understand that their treatment is important. If you spent 15 minutes explaining to a patient why it's important to do those fillings, and then you never follow up with it, you're signaling that, yeah, it wasn't that important. Make sure that treatment follow-up is happening and you're communicating with that patient regularly to ensure that that care is going to be scheduled in your books and the patient will be taken care of. Hygiene recalls follow-up, reminding patient that they're due for their next hygiene appointment is key for long-term retention. Hygiene is the blood flow of your dental practice. A hygiene schedule that's full will create dentistry, but no hygiene appointments, no dentistry. And we're going to talk later about continuing care and how do we make those calls and how do we get those calls back. What about financial follow-ups or insurance follow-ups? How many times do you call patients to collect, and how many times do you actually call to follow up with insurance pre-authorizations and predeterminations that we sent out so we can schedule treatments? A lot of patients want to know the numbers before they book. Schedule those follow-ups and be intentional. Sending a pre-authorization or a predetermination to an insurance is great, but a lot of the times we forget to get the answers, and those treatments end up not booked and not in the books. And patient's care gets delayed because we are not getting answers. What about new patient follow-ups? When a new patient comes in our practice, it's a new family member that's coming in. It's the first time they come in our practice. A new patient follow-up is essential for creating patient retention and repeated visits from the patient. As simple as a text or an email or a card saying, "How was your visit? Welcome to our family." Builds a lot of trust and rapport and creates ongoing care and relationship with that patient. Because you know what? You didn't forget about them the moment they left your practice. You actually care to follow up. Why does it matter? This is a lot of work. That's what I hear from some administrators. Well, no, it's not. Follow-up matters because it builds trust and connection. Consistent follow-up shows patients that their health and the experience that they have in our practice matters. It turns one-time visits to an ongoing relationship and builds patient retention. Follow-up builds trust and human connection. It makes that relationship elevate into becoming real and continuous. Patients come back when you follow up. And reinforces treatment value. When I'm so concerned about that broken down molar and we want to put that crown on it, and you let the patient walk and you never talk about it again until they come back for their hygiene appointment, it's simply saying it's not that important. No, that's not how we want to take care of our patients. Reminders of the patient, reminding the patient of the unscheduled treatment plans and the treatment that needs to get done is very important to have that patient understand how serious we are about their oral health. Not only that, when you continuously follow up with your patient, you improve compliance. The commitment that you see from your patients to your appointments, to the schedule, becomes real. Patients care more when they hear from you more. And I'm not saying have empty follow-ups just to call patients. Not at all. Follow-ups are intentional and they are there for a reason. We don't want patients to fall down through the cracks. We want to follow up so we don't miss appointments, delay treatments, and have patients drift away. In some practices, we see patients who haven't been for 18 months, 24 months, and we don't understand why they haven't been contacted. We don't want to shift that patient from an active patient to an inactive patient and start struggling with reactivation process. I would rather do proper follow-ups to engage those patients and remind them that we are their dental care provider. We are the office to go to when they need dental care. It's very important. So, what do we do with this? Here's your action plan. Write down a protocol for follow-up. Where do you allocate follow-up notes? How do you remind each other? What if Susan is the one who does all the follow-ups and she's away and she has it in a little book hidden somewhere and we can't find it? Create a system, not a sticky note system, a system that works, that's digital, and all of us can physically access it. If Susan is away, the office does not stop. We have to continue with patient care. Be clear, consistent, and have your system written down, because if it's not written down, it's not true, and it never happens. Assign it, hold people accountable, and listen to your patients.